35 years, but the column goes back to like 1935. And so my dad was born in 1939, my mom was born in 1941, but my grandmother was here, my aunts and uncles were here. And it just reminds me of them in that era. And again, just thinking about just, you know, all of the wonderfulness that was going on, right? And I couldn't be at that time. So I just love that. So, state of our children. So, like I said, we think about children and we hope that they're protected. We know watching the news is enough to tell us, right, that children are not protected in a lot of different ways. When we talk about minority children, the reality is Black and brown children are really not. Number one, we are the global majority, right? But even in the United States, children that are, are Black, Latino, Indigenous, Native, Hawaiian, or Pacific Islander actually comprise about 50% of the children in our country. And then when we look at children under 5 years old, they are definitely the majority of children. So they're really minority in this context. One of the challenges about that is that children, unfortunately, very disproportionately poverty. And so the poverty rate for children here in the West is about 17%. Here in Cuyahoga County is actually almost 30%, and then in the city of Kingman, it's actually 50%. And so when we talk about health inequities, poverty compounds that, right? So that's always going to be like an underlying foundation that makes things worse. Poverty is not the only risk factor, of course, because there are definitely some inequities that cross socioeconomic. So just as for context, there was a report back in 2014 by the National Black Child Development Institute, and they have a report for every state. For Ohio, they actually ranked Ohio, they noted rather that Annie Casey Foundation, just like for child information, noted that Ohio is the second worst state for Black children in the United States. And that was for one, the poverty level. Two, for the high maternal mortality and morbidity rates, which of course transcend into preterm rates, very low birth weight and low birth weight rates for children, and ultimately infant mortality, which is very much driven by preterm. And so that lifestyle, even before children are born, to Black women are stressed and not prepared with the way they should, and that transcends to their babies. And so that, along with our very ridiculous issues with lead, we know that Flint made national news, but there was also like a New York Times article that talked about, well, yes, Flint was making the news, but actually Cleveland's been dealing with this in higher prevalence than Flint. So this has been an ongoing issue. Thankfully, it's getting better in some ways, and so we'll talk a little bit about that down the line. But along with violence, high homicide rates, and then the higher prevalences of all the kinds that kids do deal with. So while we may not be seeing hypertension and diabetes and things like that, Black children are much more disproportionately impacted by asthma. Actually, early onset diabetes. Early part of my career, I never treated patients for diabetes, unless it was type 2 diabetes, like juvenile diabetes. But now children that have recent years of work, we are actually seeing diabetes much earlier. But also race of teen pregnancy, mental health is huge as well. And so all of that together really put our children in a really contentious state. And so I won't touch a whole lot on this. I think y'all probably, I'm sure you all know that, we are like a poster child for redlining, right? We know redlining was not unique to Cleveland, but back in the 30s when zoning was happening and where were the quality mortgage district, who were the quality mortgages going to, where the not low quality mortgages going to, it was the Black folks that were kind of confined to that red area, right? And so when we look at where African Americans live, my daddy was one and my mama was probably in the womb in 1940. That's where we live. Linville became one of those big areas, right? And was in a lot of ways a wonderful place, but then over time became very overcrowded and disinvested by the city. And so when we think about these inequities that I mentioned, infant mortality, you can see those bigger white circles, that's very much in those red line areas, and then in the suburbs, we all know, especially on the east side, it was Black. And then when we look at today's infant mortality rates, that continue. So infant mortality for Black children, you can see, is 164% higher for Black babies than it is for white babies. Meaning, white babies, which no baby should die, right, in their first year of life, but 5 out of 1,000, whereas for Black babies, it had been as high as 16 and even higher, and that was back in 2011. So that number has come down, but you can see the ups and downs, right? It's not consistent, so we still have a very long way to go, and there's still a huge disproportion. And that's also compared to other groups, compared to the Hispanic community as well as Asian. So same goes for lead. stands to reason. We have a lot of homes, disinvestment in the homes, city not being able to kind of keep things up, land people who are renting homes to people and not really, taking care of those homes. And subsequently, we have our primary source of land, which is houses. I had a little guy who, sweetheart, came in, lead level was like 50. Like, how in the heck did it get to 50, right? And so house gets checked. House actually was fine. So whoever, that family took care of that house. They, whoever owned that family, whoever, the family bought that house, made sure that a baby was done, house was cleared. But as we know, there are a lot of houses that get demolished, so they're empty lots. So he played in the same place, which was next door in the empty lot, and that's where that lived. So even when families take the time, the energy, and the money to get a baby for their homes, there's still other places where their children can be exposed to lead. And so the bright side of this is that the lead levels have come down. Thank goodness I have not had to have a patient get lead chelation in a long time. So that's when they get admitted to the hospital. They have to medically take medicine basically get that lead removed. So that hasn't happened in years, which is wonderful. So you see those really high levels, we don't see as much. So the levels have come down. We used to use 10 as a cutoff as considered abnormal. We dropped it down to 5, and actually for this we dropped it down to 3.5. So there is normal lead level. That should not be used. Anything is abnormal. And honestly, even when before the level gets to 5, IQ levels can drop. So like any lead is abnormal. So we're moving in the right direction. We'll talk a little bit about why that is. Teenage pregnancy rates, also another number that has much improved over the years. If you look at 2013, for girls who are 15 to 17 years old, the number of pregnancies per 1,000 was as high as like 30 or 31. And that number has come down. But you can see again, our Black girls are more disproportionately impacted by that. And so really in terms of thinking about sexual health education and contraception availability, which we know is becoming more and more of a huge issue, both in Cleveland and our inner ring suburbs, and we know our communities are predominantly Black, still disproportionate number. Mental health, which I know we'll be talking about, but Black children, particularly, I think in the past, we didn't maybe think about it as much. Maybe there was this disconnect. I used to have families that were very hesitant to engage in therapy, and with mental health services. I feel like that's changing. I think the need, I think families are recognizing the need and wanting that service. The challenge is making sure we can connect families, and so access is still the issue. And so building trust, as was noted before, improving access to care is huge. And then if you have a child that also has the identity of being an LGBTQIA community, that just compounds their risk for depression and suicidality. And so suicide has really jumped up really high, particularly with the pandemic, in terms of causes of death, unfortunately. So some more, I know that's why I talked about this stuff earlier. A lot of numbers that can make us kind of sad. The other numbers that are particularly getting worse, we talk about some numbers that are getting better, but numbers that are getting worse are homicide rates, as well as the rates of obesity, which of course continue to transition into adulthood, and lead to continued issues with chronic illness such as hypertension and diabetes as adults. Homicide, unfortunately, in 2020 surpassed motor vehicle accidents as a leading cause of death for children. That's madness, right? That should be preventable. And there's so many ways in which we can talk about this today, but you all know, there's access to guns, community violence by those who should be protecting us, all those different levels of violence that contributes to that number. And so definitely an area that continues to be a huge need. And obesity, same. There are definitely a lot of school-based interventions to ensure kids get access to healthy food. We've got some, some fresh food and some better, we got some grocery stores and some places that they weren't before, and so access to fresh food is important. Costs are still an issue, right? And so there's so many structural issues that impact these needs. So again, I talked about the protection of childhood, maybe not so much. I won't lean on this too much, but one of my colleagues who is a Black female pediatrician and scientist, she did this study about bias. Because people think, oh, babies, no doctors or nurses or whoever, they're not possibly be biased against a baby, right? It's a beautiful brown baby. So she calls it the beautiful brown baby study. Because you're like, who's biased against beautiful brown babies? But people are, unfortunately. And so this was a study that looked at the implicit association test, which is a test that, basically gauges your bias based on different groups. They have all different kinds of levels of it. And so they looked at trainees, like residents, across different specialties, so pediatricians and others, right before they started their ER shift. And when they took this test, they actually did find a pro-white bias in these residents. And so in one sense, you're like, oh, I've already been working there, but the goal in doing this is to be able to take that pause, right? And kind of say, okay, let's reset. What is your issue? Let's make sure that we are, treating all of our children equally, and as individuals, not as a group. And so it's just indicative of the work that we have to do on the provider side as well. This just speaks to kind of the same in teachers. We know Black children get suspended way more, even in preschool. Our son got suspended in preschool, like it does happen. Even when you make, a decent amount of money, it doesn't protect us from that, right? But kids are much more likely to get suspended all the way across, all the way through. And that number just increases percentage-wise as you go through elementary school and high school. And when we think about, again, violence and finishing school and all of those things that contributes to how that impacts lifespan and the rates of homicide, that that is a very somewhat of a part. And then just studies that have shown that folks just don't look at our babies as being innocent. They don't look at them as children. They see them as older. And so that bias increases, unfortunately, a lot of the issues that we see. So where we're going, so on the pediatric side, there's this really great study that was done by some of our colleagues in PEDS that looked at the impact of racism on child and adolescents. Because the reality is racism, whether structurally, like redlining, or interpersonally, has impacted the health of our children. And so the things that they mentioned, which, because I think it can be overwhelming, right? Oh my goodness, how would we possibly address all of this? And so the thing is, find your lane, work in your lane, do your thing, find the people that can do that first. And so on the pediatrician side and the nursing side, we have to optimize our people practice. We need to make sure that we're acknowledging that people have biases, that we create spaces that allow for pauses and not be overworked so that people can treat every child as an individual, not as whatever their bias is in their head. Optimizing the workforce is increasing diversity in pediatrics. There are probably, I may get the number wrong, maybe like 6 Black general pediatricians in the city, and that number hasn't really gone up since I started. Other big thing, which is huge, is looking at systems, community-based programming, policy, advocacy. That is a huge part when we think about all the structural issues. And I mentioned bias. And of course, optimizing research for our researchers. So very quickly, there have been studies that show that Black doctors matter. It does matter if we're in the room. Our babies do better if we're in the room. Our babies in the neonatal intensive care unit have better outcomes if there's a Black doctor in that room. If there is a Latinx physician and they are taking care of Latinx family, that patient has better outcomes. They have better patient satisfaction. And same for this recent study that just came out that shows that if you have a Black primary care pediatrician physician, then actually that improves life expectancy for patients. So representation is huge. It's a long journey, but it's huge. It's tremendously important. So that's why I do a lot of better on both at the medical school and then the other wonderful thing, which I just want to highlight, is that a lot of really wonderful people and programs going on in the city that have nothing to do, they didn't start in the hospital and say, let's do this. These were people in the community that said, this is a problem, this is my family, these are my cousins, these are my friends, and we need to fix this. So Black-led, Black-started community organizations, I think, is huge. Support them, uplift them, partner with them. So programs like Village of Healing, which is prenatal care, and women's mental health, or communities, Pregnant with Possibilities, which has a focus on teen pregnancy, and then Cleveland Peacemakers Alliance, which has a focus on mental health. And then one of the highlights for LED, there has been a ton of advocacy. So back when I was working in East Cleveland and I was admitting kids off and on population, daily, reason part of the reason that doesn't happen anymore, or at least happens very infrequently, is because now we're not screening kids to screen the house. We basically used to screen kids to screen the house. So we see a child have a high lead level, then they go screen the house. So now house has to get certified as let's say before that family moves into that house. And there's work on for families to kind of let a baby done, and for owners to have let a baby done so that when that child is in that house, they're not going into the digital. So all in all, again, we got to find our lane, find our spot where there's a teacher, the judicial system, child welfare and social work, on the physician side, nursing side, and then partner with families, partner with communities. They basically kind of set this scaffold for children to have better futures. As they move into adulthood and get away from me after 21, 22 years old, and they will be happy and healthy. Thank you. Okay, one more slide. So I'll just leave y'all with Nelson Mandela.